It's nice to have you with us on Health News. A warm welcome to the program. I'm Yomi Otaigbe. Healthcare funding sources in Nigeria come in several ways, from the federal, state and local governments, which fall under public funding, to development partners and through health insurance provided by some companies for their employees. But the most common source of healthcare financing in Nigeria is the out-of-pocket payment made by households, which is estimated to be about 70% of healthcare payments in the country. The National Health Insurance Scheme, which ought to cover all Nigerians in terms of health coverage, is still very low, with just about 6 million Nigerians, mainly federal civil servants, enrolled on the scheme out of over 160 million people. How can these be improved on? What impact do out-of-pocket payments have on individual access to health services? These and more for you on Health News. This week, the Chief Executive Officer of Avon Health Management Organization, Adesimbo Ukiri, is in the studio for our discussion on healthcare financing in Nigeria. Thank you so much for speaking with us on Health News.
It's my pleasure to be here.
Okay, just to start with, what's your impression of Nigeria's health sector?
I think it's on the brink of a transformation. We've come a long way, but there's still a far distance to go. When you talk about healthcare sector, I mean, there's so many parts that make it up. There's the part of, being able to have access to healthcare, financial access, and that has to do with health insurance. There's also geographical access, and that has to do with the spread of hospitals and facilities and clinics across the country and how easily people can reach them. And there's the delivery side as well, which is the side where the hospitals really are the ones that play the key role. They are the ones that actually deliver the service to the people. And in addition to hospitals, you also have diagnostic centers. These are the institutions that will deliver the healthcare to people when they need it. So I can't leave out the pharmaceuticals industry either, because the availability of drugs and medicines are quite important. And in taking an overview of the healthcare sector, you have to look at how are we doing as a country on the supply chain side of pharmaceuticals. So across all these three key areas, I think there's still a lot of room for improvement. There's a lot of things that we can do to make healthcare of a consistent quality available to Nigerians.
Our focus today is on finance in the health sector, health insurance. You know that right now most of the payment for health is out of pocket by the patients.
Yes.
Governments, funding has been very poor, for a long time. So how is this going to affect access to healthcare?
Well, it's actually something that I think is on the forefront of the Nigerian government's mind at the moment. There's a concept called universal coverage, and what that really refers to is, the ability for everybody in an environment or in a community to be able to access healthcare when they need it without the risk of financial ruin. So how do people pay for healthcare when they need it? We all know out-of-pocket payments for healthcare is not the way to go. It's not effective. It's not efficient, And the way other economies and other countries have been able to get around that is this concept of health insurance. Now, there's also, when you say health insurance, you can talk about it in various ways. There are various models for it, because I think each country recognizes that there are various segments of the population, various income levels, and people have different levels of affordability as well. But, the aim should always be that no matter what your income level is, no matter what job you do or where you live, you should be able to have financial access to healthcare services when you need it.
Okay, and then that's where the National Health Insurance Scheme comes in.
Yes.
What's your take on this scheme so far?
The National Health Insurance Scheme, it plays a dual role at the moment. So we have the National Health Insurance Scheme as a regulator. We also have the National Health Insurance Scheme as an operator. They do both roles right now. So while they regulate all the HMOs in the industry, they are responsible for accrediting companies that want to participate in this sector and also overseeing the activities. The National Health Insurance Scheme has also come up with a number of products which it offers to the Nigerian public. One of this is the formal sector product is what it's called, and this is a product that is available to civil servants. And it's subscribed to right now mainly by federal civil servants working in the ministries and their agencies. But they've also come up with a voluntary health insurance scheme, which has been thrown open to Nigerians to avail themselves of. And they administer, the schemes through the HMOs that exist in the country.
And the coverage of the National Health Insurance Scheme?
Well, right now, the population that is covered is put around about 5 million. Sometimes this goes up because there are also other initiatives like the infant and maternal mortality. There's an initiative which is built around the MDG goals and certain targets to be achieved in respect of infant and maternal mortality. And so this also tends to show up the numbers of people with health coverage quite a bit.
But 5 million out of over, let's say, 160 million people?
It could go up, maybe a little bit beyond 5 million. But I think the general consensus about watchers of the industry is that, countrywide as a population, penetration is only about 4%. Nobody disputes that when that number is mentioned. There are also what we call, private health insurance plans, which companies as well as some other maybe individuals have availed themselves of. And but you are right; it's not something to boast about that our penetration has been so low. But I think that's why the federal government in recent times has decided to be very bullish on it. There's a presidential summit on achieving universal health coverage. I know that there's also some committees that's been put together to make a recommendation to the president on what we can do to at least get this 4% up to 15% in the very near future.
Okay, and what will be the percentage that the health management organizations, contribute to this health insurance?
I think the idea really is to ensure that the health management organizations that exist are in the forefront of making this available to all Nigerians. The government, as working through a regulator, can't do this. There are about 74 licensed HMOs in this country, and some have a national license. And with 74 operators, there's no reason why we shouldn't be able to reach every nook and cranny of this country and be able to make health insurance services available to all.
But so far, we still have more Nigerians outside of this health insurance scheme. And speaking of the health management organizations, sometimes the hospitals that they work with, like the one I use, you go there, normally perhaps I'll pay for consultation, maybe 500 naira. But because I'm under health management scheme, then I pay more. Like my company pays more. Why is this?
That really shouldn't be the case. I mean, the whole purpose and the whole model of health insurance, the way the HMOs, the way we practice it in Nigeria under regulatory guidelines, is the concept of pooling of risks and pooling of resources. So the hospitals that work with HMOs normally would be contracted to do so on a very clearly defined tariff regime, which means that all these services are already, they've been discussed, they've been agreed, what rates are applicable for which services are meant to be cast in stone, and there really shouldn't be an instance where a hospital is charging something higher. But then, I have to also see it from the hospital's point of view, because I do understand that historically, HMOs have not been very, should I say, prompt in payment of claims to the hospitals. Many HMOs, hospitals complain that HMOs sometimes don't even pay the contracted tariffs, and when the payments are coming, they come in pretty late, sometimes up to 6 months later than they have billed the HMOs for these services. So, I mean, there's a lot of tidying up that needs to happen between the hospitals and the HMOs, when it comes to payment of hospital claims.
Can individuals aside from those working for government and maybe in the private sector, individuals who work for themselves and they want health insurance? Is there any platform for them in Nigeria now?
If we look at how the industry has evolved, I think prior to now, most HMOs had tried to offer health plans that cater to individuals and families outside of companies and governments, and it's been quite risky for the HMOs, because the first onslaught of registered people they would get are the people who are already ill and know they have these ailments or they have these needs for surgeries, and then they go and take up the plan. So HMOs in the past have gotten quite burnt, offering plans to individuals, because when the plan is sold to a company, the risk is diluted. You will get some people being ill, you will get some people being really healthy, and everybody will not be making claims at the same time, and everybody wouldn't be visiting the hospitals at the same time. That's where the risk has been for most HMOs, and they've just not invested enough in generating the level of awareness and level of demand that will ensure that even when individuals begin to register on these health plans, they are able to get a large enough pool to make the risk diluted. And there are also other things which other markets do to minimize the risk. Okay,
just quickly now, because we're really running out of time. How does this health insurance scheme work? For instance, is there contribution? I know that people who have more, let's say, higher income earner, they pay more so that others can be covered. How does it work, and how can everyone, because right now if only 5 million people are on the National Health Insurance Scheme is not good enough, how can they be strengthened?
We can discuss this on a national level. We can discuss it also on a state level or corporate or an individual basis. Even as individuals, like you rightly said, we belong to several income segments. And if we're talking about the private health insurance, it stands to reason that, it needs to be paid for by individuals from the income that they are able to generate. We have a wide variety of plans, priced differently, using different hospitals. So we believe that we have something that suits every income bracket. But then you could ask the question again, what about those that are not working? What about those that are disabled? What about those that are retirees? That's where the National Health Insurance Scheme would kick in, or that's where what we call subsidized health insurance should kick in at the government level. There are ways other countries have done it. There's funds obtained through taxation, for instance, but there has to be a way to make, like you said, healthier people look after the people within the society who are less able to do so for themselves.
Okay, so if you have to advise the government now or the new NHIS boss as to how you think this could be better, what would you say?
I guess I would first say that we don't have to reinvent the wheel. There are many case studies from other parts of the world where this has been done successfully. And we can find one or two who, in terms of demography and in terms of the development of the country, infrastructure-wise, is very similar to ours, and we can learn from them. I would also say that private participation is crucial. It's very important. And making the market an open and competitive market amongst the HMOs would also go a long way in helping to make that possible. And I would say, that he be very courageous and bullish about achieving his mission and the dream that he has, because this is a real opportunity for him to leave a lasting legacy.
Thank you so much for being with us on the program.
You're welcome.
Thank you.